Yeah, of course, Tom gave us such a good overview. A couple of things. One is that the whole nature of Medicaid, had this case done what we feared, the whole nature of Medicaid would have changed. And we're going to talk about cases where the court seemingly uses, or, in some cases kind of concocted a dispute that it then uses as a platform for blowing away a vast area of law. And here it was a very prudent decision. The structure of Medicaid rests as an entitlement program on this Civil War statute. In Medicare, your right to sue is right in the statute. In employee benefits, your right to sue is right in the statute. Medicaid doesn't have a provision like this. And so had they knocked out 1983, the Civil War provision, the Medicaid program that we know as an enforceable legal right would have gone away. We are caught in this world, as Tom points out, where we're going to crawl provision by provision by provision, and there are cases in the pipeline. The most notable being the one that Tom mentioned, which is free choice of provider. And just so people know, this is not just any old provider. This is state efforts to kick Planned Parenthood out of the Medicaid program, and so it is very, very fraught. Planned Parenthood and beneficiaries have fought this on the ground that beneficiaries have this right to go to any qualified provider that can furnish the service. And of course, they argue that the grounds for kicking Planned Parenthood out are concocted. They're baseless. And so this is a violation of beneficiaries' rights as well as providers' rights. But we could find ourselves next year suddenly back in court over free choice. And just to close out, to give people a couple of sort of Christmas future examples, which we used in the Health Affairs article, had this case really been the basis for blowing away 1983, the kinds of things that would go unchallengeable I just want to be sure people understand. For example, a state could say, it's July, we don't have a new fiscal year till October. So hello, everybody, we're not taking any new applications until 2024. Or they could have said, as actually happened many years ago, we really resent the fact that children in Medicaid have very comprehensive benefits, including dental care. So we're going to remove dental care from their benefit package. We're just not we don't feel like funding it. We don't want it. Our kids don't have dental insurance. They shouldn't have dental insurance. These were all situations that were successfully challenged. Had Talevsky gone the wrong way, beneficiaries, and in some cases providers that have rights, would have been left with no recourse. We would have all depended on HHS to come and investigate and enforce a law. And I'm sure Tom can tell you what the challenges are for getting the federal government to come in and challenge a state's decision to basically violate the Medicaid statute.
Or another example, sorry, Alan, another example. So there are these new gene therapies that are probably going to get approved by the FDA in the next 6 to 9 months that treat diseases like sickle cell anemia. Well, what if the state says, you know what, the drug's too expensive, this therapy is too expensive, we're not going to cover it, even though the manufacturer is complying with all the requirements of the Medicaid program, even though providers that prescribe it are complying with all the requirements of the Medicaid program. A state could just say, you know what, it's too expensive, we're not going to pay for it. Direct violation of the Medicaid statute, that would be a violation of section 1902A54, but had Wilder been overturned, there'd be no recourse other than CMS coming in and slapping the state for violating the requirement. But the problem is, Sara says, there's maybe 200 people at CMS that have to enforce 87 requirements in 50 state Medicaid programs, plus DC, plus Puerto Rico. There just is not the people power to enforce all of those requirements in all of those state Medicaid programs.
So I just want to spend a moment on this last point of sort of what the regime is without a federal cause of action here, which is you can go through the state system, but the assumption is that if it's the state's policy, the odds that, for example, the state courts will rule in your favor are lower.
The governor's policy that's going before a judge that the same governor appointed.
Exactly. And then the issue is, do we just treat this as sort of a federalism issue? It's the federal government trying to enforce provisions against the state. And after all, Medicaid is a financing mechanism that provides federal funds to states. And if they don't comply, the federal government can have its array of potential interventions, but it's not just a personnel limitation, it's also a small p politics issue here, which is to enforce against a state means to enforce against members of Congress and senators who have a great deal of authority and power, who may not look fondly on efforts to enforce. So that the pulling the individual out of the picture makes this basically an institutional battle, as opposed to the individual being able to bring their action in a venue that presumably has some distance from the state, that being the federal courts.
It's probably also worth noting before we move on that this issue has been boiling for 50 years. If you look at the history of this relationship between Medicaid and the Civil War amendments, 1983 specifically, this has been the source of great unhappiness on the part of states for decades. But nobody in Congress has ever been willing to change this, because it is not lost on Congress that the entire structure of a program that insures now 90 million people, is tied to this relationship. So, well,
I will. Sorry, one last personal note. When I ran the Medicaid agency in Colorado, I got sued every week under Section 1983, and it took a while to not take it personally. But I did come to realize that there's also a big balance and power shift here. Is that if I knew that every one of those lawsuits was only going to be resolved in the plaintiff's favor if they were able to convince someone at CMS to elevate and escalate, I could have just easily looked the other way at all of these, knowing that just as sheer numbers, there's no way that I would lose very many of them. But we had to, not surprisingly, take every single one seriously, not just on the merits, but because there was a federal lawsuit pending against us.
Yep.
Ruqaiijah, it looked like you wanted to.
When we sued Texas 40 years ago over the elimination of dental care, the state was very happy, actually. The agency was very happy that the suit got brought.
Yeah, that's another story.
I just wanted to jump in to say what is exciting a little bit about this case is that it is one of the Supreme Court cases that did recognize its precedent. And so it was a great thing that it continued to support the private right of action, but as was mentioned earlier, it did not fill the gaps that we see and the contradictions that we see. As Thomas mentioned, not all of the 87 provisions have been recognized by the court as providing a private right of action. And so particularly as we think about the equal access provision that requires that those on Medicaid receive the same sort of services, efficiency, economy, and quality of care as others, that this still is a question out there and will impact Medicaid participants.